Hi, this is Dr. Neal Schwartz. Today I'd like to discuss my comprehensive opinion on health-related websites and online forums for medical conditions and for health problems. Over the past 8 years, I've watched the internet blossom and I've seen how websites have taken the place of many professional resources in good and bad ways. Today I'd like to discuss the pros and cons to health-related websites, informational websites, and forums where people give each other health advice online. Number 1, they are free and highly accessible. That actually is an important clinical factor, as compliance with any aspect of healthcare development or any improvement of health is a critical factor, and having it be free and accessible at home increases compliance and thus increases the clinical outcome in some cases. Number 2, they can be fun. Whether it's from meeting other people who have a similar condition that you have, or from finding a community after isolating yourself, it's fun to interact with people who know what you've been going through, and this sense of fun also can help clinically, because when you're improving on your health or on your life, it sometimes requires a fun stimuli to get you in action. So if the fun of these websites actually gets you in action, taking care of your body or taking care of your skin or taking care of your digestion, that is a positive clinical outcome because the fun of it has increased your action. Number 3, they are very loving. Whether it be a forum for polycystic ovarian syndrome or an acne forum or a forum dealing with weight gain, people go to these sites to get love in a lot of ways. And again, clinically, getting love sometimes is the motivating antidepressant that gets people in action. So whether it be accessibility or fun or getting attention or getting love, if those things convert into actions of taking care of your skin or your bowel or your musculoskeletal system or your general mind, soul, well-being, and expression, then those websites have clinically and medically helped. So after closely observing these websites for the last decade, I realized that there are many pros and benefits to them. And I can tell that many of the operators and developers of these websites have good intentions for the world. They want to make people happy and they want to make people well. And sometimes they actually do. And that is the list of pros of online health forums and informational websites. Now, as a scientist, a doctor, and a healer, there are many issues with informational websites and online forums that end up concerning me. And it has nothing to do with losing business or worrying about doctors losing any of their clout or power in the community. This is not why I'm making this video. I'm making this video because as an academic physician, I know exactly how these websites can harm people. And with that introduction, I'd like to discuss the cons of both health-related informational websites and health-related online forums. Con number 1. Quote, "First do no harm." This is the quote that all real doctors live by. Before you touch a patient, before you speak to a patient, you have to consider that you first do not do harm to them, because altering the body chemically or physically or surgically can and often does create more problems than solutions. And so doctors have always known to live by a certain code, which is first do no harm. And legally, all the malpractice laws have been generated around this widely accepted philosophy. So, one of the cons of informational websites, and especially online forums, is that people give advice without considering the philosophy of medicine, which is, quote, "First do no harm." What happens when people disregard the first do no harm philosophy is that unsuspecting viewers and unsuspecting recipients of information will be harmed. Because if the givers of information, even if well-intended, are not on point, or they don't really know what's going on, or they don't have a real patient practitioner relationship with this person, which they never do, then there is a risk of doing harm. And so when choosing to use these websites and forums, it depends how much you respect the concept of first do no harm. If you've ever taken advice from someone about your health or about your body and it's gone awry, then you know from personal experience that first do no harm is a very important philosophy. But if it's never happened to you, you may also, unfortunately, learn the hard way, because, that's how we learn sometimes, is the hard way. We have to do it ourselves. We don't always learn from other people's mistakes. But I'll let you know, as a widely accepted philosophy, first do no harm is the general code and philosophy of medicine. And everything you do in a doctor's visit is geared towards that philosophy. Whether it be putting all your medical history down, all your allergies, all of those things help doctors first do no harm. The way I stick with the code of first do no harm in the acne practice is that I'm not really making any intense diagnostic work. Everyone who comes to me knows they have acne or suspects they have acne. The truth is, acne can be diagnosed by a 5-year-old at Thanksgiving dinner. It's very easy to diagnose. You can diagnose it from almost 10 to 20 feet away, and it's always just plain old acne. And no matter how special you think the case is or how different you think it is, it tends to be plain old acne. It's just very stubborn. So some of the actions I take to maintain the safety for my clients online, since we're not seeing each other in real life, is they ask me, do you think this is acne, or what type of acne is this? I'll typically say, it looks like plain old acne to me, but if you're concerned at all about your diagnosis, about acne, rosacea, folliculitis, all these common inflammatory bumpy conditions of the skin, feel free to get a diagnosis from your local physician, and then you can come back here and we'll take care of it. Con number 2, quote, misery loves company. Not to offend anyone and not to inflame anyone who is absolutely in love with their online forum. That's not my intention here. But just to give a comprehensive opinion and discussion, pros and cons of these types of websites. It's important to know that in general, misery does love company. When you're unhappy with the way your body's working or you're depressed, it is much more comfortable to be around others who are depressed and who are also unhappy with their body or their skin. This misery loves company phenomenon and this tendency creates a new problem. One depressed person makes the next depressed person more depressed, and then reciprocally makes the first person more depressed as well. And the whole community drops into a deeper state of hopelessness. It's similar to alcoholics all hanging out together in the same group while drinking. I think we've all seen an example like that, where those who are imbalanced find others that are imbalanced, and then together they get more imbalanced. You see it in certain gangs, and you see it in certain groups of people who are unwilling to take care of themselves and want to find a home or a home base in their misery. And so the cliche, misery loves company, certainly plays when it comes to online health communities. Rather than getting better, people end up indulging in their illness and labeling themselves with their illness even more than their doctor did, or even more than they did when they found out the diagnosis. And they become a community of sufferers. This deepened hopelessness is one of the cons of online health forums that I have witnessed for the past 7 years. The most hopeless acne sufferers I meet are the ones that are deeply ingrained in communities that have told them that there is no way out. And you can see that this type of hopelessness is actually the real disease when discussing treatable conditions like acne. In these types of communities, people may actually be convinced or backed up when they say, my acne is special, or my acne is different, or my acne is untreatable. In those communities, others may indulge in that misery and continue to back up that logical conclusion. That was one of the catalysts for me building the video gallery. I saw the hopelessness deepening online. I saw people were getting more and more hopeless as others jumped into the mob and to tell them there's nothing you can do. And with that, I decided to create an evidence-based discussion, an evidence-based argument that said all acne is treatable, and I'll prove it. And obviously, I did. The only people that come to me with this level of hopelessness now are those who haven't witnessed the gallery in full. If you are deeply rooted in an online community that has convinced you that your case is untreatable or hopeless, I recommend looking at the evidence rather than the hype. And the evidence is the video gallery that's on the homepage of the site. Con number 3. When unhelpful, these forums act as a major distraction for someone to get appropriate medical or wellness care. So, as someone wades and indulges in their problem on these forums for a long time, their condition gets worse and they risk further scarring. As we know, acne is a time-sensitive condition, and every day that passes equals more and more wear and tear. So, to indulge and spend a lot of time in a resource that is not bringing you great results is a distraction from you actually having gotten proper help and quickly getting better. If there were no time sensitivity to it, there'd be no real big problem. You could try this for a little bit, if it didn't work, whatever, and then you go on to your doctor next. However, acne is a time-sensitive condition, and scarring and wear and tear are the result of inflammation over time. So if you remain inflamed on these websites, whether it be informational or forum, for a long period of time, that's the degree of wear and tear you're going to endure. Now, you can also work on wear and tear later. It's not a hopeless situation either, as shown in the 3D scar videos on the site. However, it's a lot of work to soften up those scars, so it's just important to know that there's a time sensitivity to all inflammatory conditions, as inflammation creates wear and tear, and that these health-related sites and informational sites can distract and waste time. Con number 4. Quote, "The blind leading the blind." Unfortunately, no matter how good someone's intentions are, no matter how loving they are, and no matter how warm they are, their medical advice as an amateur may not be what you need. So what I often see on these websites is that those without proper training and those without proper knowledge become leaders of communities and then get a false elevation of their knowledge. They may not possess the actual clinical skills to get every person better, but they play as if they do. And in that swagger and in that ego, they end up harming many people, as amateurs often do when they give medical advice. Con number 5. Misconceptions get hardened. In the online acne forums, if someone puts up a complete misconception of a condition, but it has a nice ring to it, or it has a good imaginary thought based on it, others will jump on it just based on belief, not based on evidence and not based on any clinical resources whatsoever. It will be based in imagination and very few anecdotal cases. When this happens, this phenomenon of the online forums creates even more hopelessness, because misconceptions are then spread for the next decade. And I have people emailing me with things they learned on these forums that are absolutely horrifyingly bad for their acne. So it's important to understand that some of the things that may be considered common knowledge at this point regarding acne and other inflammatory conditions are completely misconceived, but they've been backed up by hype, imagination, and more of a mob mentality where people jump in without having any real clinical evidence. Anecdotal cases that show improvement here or there without an extensive gallery don't really prove anything, as you can get better from conditions sporadically and randomly and through many other variables that are going on at the same time. So unless someone's showing an extensive body of work, it's hard to believe that they've stumbled upon the next great thing. Con number 6. Fear is contagious and addicting. I found many times on online forums that Demonization runs rampant, whether it be ingredient fears or fears of food or whatever it may be. I found the addiction to fear and the addiction to demonization runs rampant on these types of websites. So you can imagine that this type of group paranoia, or what used to be called mob mentality, really runs amok on these types of online forums, and this video is being made so that you can witness that phenomenon and not unsuspectingly get beat by the hype or get bad advice from what is, quote, popular without any evidence whatsoever. Con number 7. Everyone should know the concept of confounding variables in case studies for medicine. When someone embarks on improving their health, they take on many new variables, whether it's, a higher level of consciousness or multiple different things that are changing in their life at that same time. Some of them are very unconscious. So when they get better, they may attribute their improvement or their health to one of the many variables that has just gone down. What typically happens is that this attribution is a guess, and people attribute their newfound wellness to whatever they believe did it for them. Keep in mind that belief is just generated from our minds. It's not evidence-based. And so in an anecdotal case study, one without an extensive gallery, one that has not been controlled in any way, people are going to say, this is what cured me, or this is what fixed me. But really, it may have been a multitude of factors that are either conscious or unconscious going on at the same time. It's the concept of attribution, and it describes how patients will attribute their improvement of health onto anything and everything without any real closed, controlled study group. Quote, the dead end. I spoke about this in one of the prior cons, but I wanted to be more specific here. When unsuspecting viewers or participators in these online forums are there for many years, at some point, if they're not better, and they've heard what everyone has to say for many years, they reach what I call the dead end. That is the deep hopelessness that comes from having researched everything and still not being better. I'll repeat that, because this comes with informational websites too, and Google. Those who research everything online and who spend years on these online forums and are still not better will develop the deepest form of hopelessness, and it will feel like a dead end. As a fact, there have been veteran members of online communities and online forums that have committed suicide due to this dead end effect. If you can't see a possibility for improving your health condition, there is a deepened hopelessness that cannot be easily corrected. The dead end is oftentimes achieved by veteran members who are deeply ingrained in these communities and who actually trust these communities more than any other practitioners. Increased paranoia to all healthcare practitioners and government. In the mob mentality, conspiracy theory, skepticism, pessimism, apathy, and paranoia run amok. And so the idea that all physicians are out to get you, or that all government officials are out to get you, or that all drug companies are evil, or that all food companies are evil, is the very shallow view of the world when you're looking through the lenses of paranoia. Paranoia doesn't take in the pros and the cons of anything. It just takes in that people are out to get you. And so con number 7 is that these online communities and forums increase paranoia. Not that we should be gullible, and not that we should be unconscious to all the systems around us and everything that's going on. However, to not comprehensively assess, say, the food companies and the drug companies and the doctors, both pros and cons, you take a very shallow view of what's going on in your world. And that type of paranoia is increased by the mob mentality that's generated in an online forum. Doctors have pros and cons, drug companies have pros and cons, and food companies have pros and cons. This paranoia essentially creates the cliche, quote, throw the baby out with the bathwater, where you see something bad or you see something corrupt and you chuck out the entire system, not having seen both the pros and the cons. And that shallow view of the world is indulged and propagated by these online communities. So here's the bottom line. I don't mind these online health communities when it comes to things that are not time sensitive. For example, if you wanted to talk about scar treatment on an online community, I could see how that would be helpful because it's essentially cosmetic at that point. And if you waste some time, discussing different methods, then at least you're not doing harm and you're not wasting time or distracting from a better treatment because there's no time sensitivity when it comes to cosmetically treating wear and tear. However, when it comes to treating inflammatory conditions that are volatile, that can go from mild to severe within a week, I find online health forums to be very irresponsible and to not really have a fail-safe for someone who's unsuspectingly coming there for help. I believe these online forums could address this fail-safe rather easily with large banners that say, if you're not getting better in the first couple days or the first week while you're here participating, please seek professional help. If they were to be a little more preventative and a little more upfront with that disclaimer, then they could take care of the people that are doing well and at the same time protect those who are not improving. Unfortunately, these are the emails that I typically get week to week. Hi, Dr. Neal. I've been treating my acne myself using an online community to help me out, and over the past 8 months, my acne has only improved slightly. I think I'm developing more scarring over the past year. Is there anything you can do to help me from here? So that's the bottom line. Since these online communities are not responsibly being more forthcoming with these disclaimers, I'll do it for them. If you are not improving on your acne treatment that is generated from an informational website or an online forum, I suggest you do not hope and wait for it to one day work. That type of hoping, waiting, and false confidence is what traumatizes people physically with wear and tear and emotionally by generating a deeper state of hopelessness. Thanks for listening. I'll be here if you guys need. Take care.